For example, ultrasound. Ultrasound is used commonly to diagnose thyroid nodules. Sometimes there's also cysts in the thyroid gland. An enlarged thyroid gland, sometimes people will, like a doctor will order a thyroid ultrasound to look because they feel like the thyroid gland is enlarged. So we'll kind of take measurements of the thyroid gland and also see if there's any nodules that are concerning for malignancy. But luckily, the majority of nodules that we see are benign. Ultrasound is commonly used for carotid artery stenosis or vascular disease. So let's say someone has heart disease. Part of the workup in heart disease, let's say they have to have a CABG procedure or bypass procedure. A lot of times the surgeon will order a carotid ultrasound to make sure that their carotid arteries aren't significantly narrowed, because if they have narrowed vessels, that might have to be addressed before the heart surgery.
Oh, okay. And then for the thyroid nodules, which one did you say was the best one to use?
Ultrasound is by far the best way to image the thyroid gland. It's very sensitive to determine not only the size of the nodules, but the characteristics of the nodule. And when we look at those ultrasound images, we look at the shape of the nodule, whether it's solid or cystic, what its margins look like, if there's any little bits of calcium in the nodule. And based on those ultrasound features, we're able to use a risk stratification system to determine which nodules can be safely followed and which nodules may need to be biopsied.
Okay. And then how long do the exams take?
An ultrasound takes about 15 to 30 minutes. A CT, for example, that's pretty quick, depending on whether or not the patient needs contrast. I'd say anywhere from 15 to 20 minutes. An MRI is a little bit more involved, and that can take anywhere from 30 minutes to an hour, depending on what's ordered and whether or not the doctor orders contrast with that exam.